In this video, I am discussing the management of diabetes focusing on non-pharmacological management and oral hypoglycemic agents. About non-pharmacological management. When a patient is coming to your OP with a diagnosis of diabetes, first you should start treatment with non-pharmacological management. They are diet control, exercise, and weight reduction. Diet control, exercise, and weight reduction. Now, what is mean by diet control in case of diabetic patient? Which type of diet a diabetic patient can take? Generally, we have to advise low calorie, low glycemic index, and a high fiber diet. Low calorie, low glycemic index, and high fiber diet. Okay. Now, telling about the glycemic index. If you don't know the glycemic index of a particular diet, just Google it. If somebody is asking you, doctor, can I eat dates? Can I eat banana? Then just Google the calorie value and the glycemic index of that diet. You will get an idea. Glycemic index of more than 80 is dangerous, 60 to 80 is average, and less than 60 or less than 50. Generally, it is good. Okay. Now about the exercise. How much and what type of exercise a diabetic patient should do? It is advised as 20 to 30 minutes of moderate aerobic exercise, minimum 5 days a week. 20 to 30 minutes moderate aerobic exercise like brisk walking or jogging or even swimming. And it should be distributed as 5 days a week. So after non-pharmacological management, we are moving to oral hypoglycemic agents, and we are focusing mainly on biguanides. That is metformin and sulfonylureas, focusing on glimepiride, and DPP-4 inhibitors, focusing on teneligliptin. And you should have a clear idea about the side effects and the contraindications of each drug. The metformin is contraindicated mainly in renal failure and also in severe grades of liver failure, severe grades of cardiac failure, and severe grades of respiratory failure. And also if the patient is prone for lactic acidosis. Now about the glimepiride. It is contraindicated in renal failure mainly, and if the patients are prone for recurrent hypoglycemia. Teneligliptin is usually having not much side effects or contraindications. So, after non-pharmacological management, we are starting treatment with metformin. I will advise it as 500 mg OD and ask the patient to come after 1 to 2 weeks. After 1 to 2 weeks, if the patient's sugar level is not getting controlled, again recheck the non-pharmacological history, that if the patient is doing proper exercise, if the diet control is proper or not. And if it is not getting controlled with the metformin 500 mg OD, then it is metformin 500 mg BD. After that, it is metformin 1 gram BD. Like that, you can go up to 3 gram per day. Okay. And after the non-pharmacological management and metformin therapy, if it is not getting controlled, then start sulfonylureas along with the biguanides. Start a glimepiride as 1 mg OD. If it is not getting controlled, then 1 mg BD. After that, it is 2 mg BD. So now the patient is on non-pharmacological management, along with that metformin 3 gram per day and glimepiride 2 mg BD. If it is not still controlled, then start teneligliptin 20 mg OD. So now the patient is on non-pharmacological management, along with that metformin 3 gram per day, glimepiride 2 mg BD and teneligliptin 20 mg OD. If the patient's sugar level is not getting controlled with the maximum tolerated dose of 3 OHS, then it is insulin therapy. Now I have described the management of type 2 diabetes, mainly focusing on metformin, sulfonylureas, and teneligliptin. There are many other categories like this acarbose category, this gliflozins, GLP-1 analogs are there. You can use that as per your preference. But for this simplicity, for the purpose of simplicity, I have described about these three drugs only. Now it is insulin therapy after the combination of these three OHs that we will discuss in next class. And one important thing, that is during each visit, after starting OHA, during each visit, if the patient's sugar level is not getting controlled, you should check diet control and exercise again and again. Sometimes it happens like we have started the patient on OHA therapy, then the patient will think that, oh, now I am on this medication, so there is no need for this non-pharmacological management. I don't have to do proper exercise or diet control. It will be taken care by the tablets. No, it is not like that. The medications will be successful only if the patient is putting some effort. That is, the non-pharmacological management is very much important, and you should take a proper history of diet control and exercise if the patient's sugar level is not getting controlled on OHA on each visit.